The fourth case I'm going to show, Bekah Gatchel. So this is a very multidisciplinary, complex TMJ case in a sense that historically she's gone through cervical fusion therapy. Complex from a medical end is because she's got cervical dystonia, Maggie's syndrome, which is kind of involuntary twitching of the muscles of head and neck, and she presents with a lot of lower back issues. So when she saw me, sought me out for her just headache, jaws clicking, popping, that kind of stuff. So as we look at her cone beam left and right side, you can see pretty instantly that both joints are very compressed. The surface is very deteriorated. And when we look at just teeth on her, teeth look pretty darn good on her. So, there's obviously something going on. Now, when I look at posture on her, posture is bad on her. So in her, we have to work with chiropractics and physical therapies to start mobilizing kind of all the areas that are trapped in creating blood flow uh, throughout. So that way her posture kind of starts improving, getting better. And she spent at this point years of doing Botox therapy just to mask the pain. Now, as we start off on her with chiropractics and physical therapy to get the back chain opened up, because without that, it's difficult to reset her bite. And then once we reset her bite and put it in more of a physiologically neutral position to kind of decompress her joints, then instantaneously I'm allowed to get rid of headaches on her. Now, we combine that with the CBD treatment, not only sublingual, but also rubbed on the joints. Kathleen's going to present here in a few days a really nice webinar on the use of CBD and how it helps on airway. And in my practice with TMJ patients, I use CBD pretty routinely. What it's used for is, helping with sleep, so we can get sleep quality to improve. So on cases like this, where we improve posture, we improve the bite position, what are we doing in essence? So as we kind of open up the bite, neutralize the bite, we're automatically improving the tongue posture. Now, as she's working with the girls on her myofunctional component, as her tongue posture improves, as the swallow pattern improves, the stability of the work that chiro, PT, and podiatry are doing, that holds better. Now, one of the issues that we run into all the time, people say, hey, I did chiropractic, it worked for a week, and then it went back. The reason for that is there's another component that hasn't worked for them really well, and then that component is the myofunctional component, and in my component, which is setting the joints properly or setting the bite properly on it. So once we balance the hips, knees, and kind of work up on her, that essentially corrects her posture, and in essence helps kind of stabilize, open up airway. We combo that with the CBD therapy, and guess what? I've got a much healthier patient. Now, yes, I'm going to deal with issues that arise on her as she ages and things like that, but for the most part, for what we're doing, I've got a good handle on the head and neck issue. And then when hips get misplaced on her, or shoulders and scapula start turning, I don't start going and adjusting my mouthpiece or things like that. I look at it, I evaluate it, put her in the right hands. And that for me is working with the right, collaborative team, because most people, it's hard for them to put together, hey, my headaches are coming back. I don't know why. I probably need to see Dr. Sidram on it, right? They don't think about, hey, I haven't been doing my proper stretches that physical therapy showed me, or the exercises that Cairo showed me, and things are getting off again. So here is pictures of her with orthotic, and you can tell, hey, I've got my head on my shoulders again. My hips are very well balanced out. My arm length, my shoulders are very well balanced out. And posturally, by working as a team of 4 or 5 partners at this point, I'm looking pretty darn good. So that allows me to kind of create really good expectations, and that's how I'm hopefully you can kind of, you're starting to get an idea and seeing of, hey, this guy, he's working. We have to work with a team of people, because alone, I feel like alone I'm not going to
I
get there.
rarely have a headache, and if I do, I know that I'm clenching too much, and I wear as much as I can because I have his typical process is different. It's getting it in the right place for a while, getting the braces, and keeping it permanently that way. But because I have the grand tetons in my jaws, we can't do anything. So I wear this pretty much 24/7 unless I'm eating or drinking anything other than water. And my hip pain went away for the most part. I mean, I have herniated discs now because I've had stuff, after, because I just have a falling apart body. But I think my chronic pain is much less, and I can bear that kind of stuff because I can't bear the headaches. And so that, like I said, that has been huge. And I've gone into him at times and said, it's hitting too much on my left side, and he would say, well, your right hip's out. I'm not touching it because then it'll throw everything off. So like he's one of my podiatrist and him are the only ones that recognize the entire body is connected. And so I love that I can go him, and he's not going to do something, extra that he doesn't need to do. He's going to say, no, you need to go address this other body part or whatever. So it said my pain has gone down and my ability to focus has gone up because I don't have those horrible, horrible headaches.